Choice Medical Group, we're a full risk entity. We actually manage about 45,000 or so patients in various counties across Southern California. Riverside County, San Diego County, Riverside, Los Angeles County, up north in Fresno County. Being a full risk entity, we take on professional risk as well as institutional risk. And so we are always looking for quality tools that can help us to integrate our network. Internally, we actually host our EHR system. We currently use the Allscripts Veradigm professional platform, and about 90% of our PCPs use that platform. And so for us, having a interoperability system, a partner such as MX was very important. For one, in order for us to get real-time ER and admit data, as well as to be able to see a whole longitudinal record. So yeah, that's a little bit about Choice Physicians Network.
Awesome. And can you remind us for about how long has Choice been partnering with MX? And really, how did Choice come upon the decision out of obviously a whole landscape of potential partners to join MX as a QHIO?
Yeah, Felix. So we've been a partner for about 8 years now. We initially signed up back in 2016 and started sharing data basically from our EHR system first. One of the main reasons we chose to go with MX, we previously partnered with another company, but they didn't really have the governance in place that we wanted to have, as well as the high trust certification wasn't available, or they didn't have it at that time. So really, those were some of the main benefits and features. And then also, we kind of felt that MX was going to be a partner here, especially in the California landscape, which we have our own unique challenges. But MX, of course, was aware of those and willing to help guide us and assist not only in the governance side, but actually speeding up the process to get the technology rolled out.
Fantastic, because like I tried to hit upon it in my overview, I think the MX value proposition is not just the technology capabilities or the tech stack, which obviously we are very proud of, but the ethos and the philosophy of really making data work, in the hands of the end user, the care teams that are out there trying to provide a better outcome for your patients.
Yeah,
Um,
and I would just add
yeah.
too, once the MX became NCQA certified, that actually was a big value add as well. For us, we do report our health risk scores directly to the health plans, and we get actually rated based on our quality gaps that we report. And having a system that actually is NCQA certified, we can take your data and send it in as supplemental standard or non-standard data directly to the health plans, which is a great ad for us.
Yeah, I'm so glad you brought that up because I feel like it otherwise it's so abstract to say we have something called the NCQA DAB certification. Like, what the heck does that mean? Can you talk a little bit, maybe probe that a little bit more, how that in your experience has helped reduce the burden on reporting things like quality improvement and performance for HEDIS?
Yeah, sure. So actually what we've done is every one of our quality program specialists and even down all the way from the director on down actually have access to MX. They're able to actually go into the longitudinal charts, look for gaps in care. One of the statements that was mentioned earlier about having full claims data and lab data, obviously that's where you get a lot of your gaps that you can actually close, right? Looking at the diagnosis and the procedures that have been done. So being able to look at a patient record as a whole longitudinally, we can actually fill those gaps quicker and deliver better quality care and then accurate data as well.
Fantastic. And it strikes me that our partnership dates back to 2016, which obviously predates the DXF and the notion of anything like a QHIO.
Yes.
Once the DXF actually rolled around, once your physician members became aware of the new state requirements, what type of transition or guidance, if any, was needed to explain to those existing partners within the MX ecosystem, how they were already set up to basically not just comply with, but thrive with the DXF benefits under the new paradigm?
Yeah, so I mean, under the DXF, obviously you want to be able to share social determinants of health. And that's a challenge a lot of times, even just for the EMR to actually collect that data and then actually be able to show or prove that you're actually sharing that data in a real-time way and in a secure manner. So that was really one of the value adds of partnering with MX. We're able to prove you guys have the security of the platform, as well as the tool sets, both the MX Access portal and then the Notify portal. They kind of work in parallel, right? So for example, if someone in our case management team wants to know when a member was admitted to the ER, they can look right in there. They actually get a notification in real time, probably within 5 to 10 minutes at times of when the person hits the ED. Then on the other end, when a person is discharging from the hospital, we want to get that discharge information and actually give it to the PCPs, right? So what we've done now is we actually have the full ADT and discharge summaries come down to us as CCDA documents, and we populate that or push that over in real time to our EHR system. We use another third-party tool set called H360. It's kind of our internal intermediary that actually takes those documents, scrubs them, and then pushes it directly into the EHR for us. So all that basically makes a full ecosystem that the providers enjoy, as well as our case management and quality team. They are able to use all that data.
Yes, and I'm really glad that you brought up kind of this unique bespoke example about how you're able to bring in the information that's coming to you through the MX platform and have it incorporate seamlessly into your workflows through other tools and services. And I think it really exemplifies how there is no one solution or approach to having MX, make data work for you. You can obviously use the web portal, which is, I think, the default approach for the majority of, especially our ambulatory provider care teams that are using our services. But you can also devise some pretty ingenious integrations, right, with your EHR systems and have it come straight in through that interface, which I imagine is something that a lot of your providers really appreciate.
Yeah.
Um,
And I
and
would say,
yeah,
initially, we did start off with just the portal piece, the MX Access, for a number of years, and that worked great. I mean, the providers just being able to look in and see a hospital chart, see what procedures were done, what imaging was done at the hospital, that was, spot on. And then later on down the line, proud maybe close to 2 years ago, we actually went the next level, right? And started the EHR direct integration, which has been even a bigger game changer for us.
excellent. Yes, that is really, really cool stuff. And I know that as we try to push the frontier of bringing in more types of not just providers in the traditional sense, but other stakeholders into the fold, as is envisioned under the principles of the EXF. There's a lot of questions as to how you would get data from a platform like MX if you don't even operate an EHR. If you're, for instance, a community-based organization or a social service provider. And I think a little bit of an aside, um, we want to really highlight that we are really ready to work with you and meet you where you are to get you the information that you need for your purposes in terms of your current capabilities. If that means setting up something as basic but as secure as an SFTP protocol to get you, for instance, data in a flat file format to help you work with um, health plans or provider groups for CalAIM care coordination, we can do that and we will do that. But what you're describing, Justin, is really, I think, a great example of kind of the cutting edge of what's possible in terms of seamless integration. I want to stick with the ADT example for just a moment because I think it also highlights kind of the vision and the execution of the DXF goals. Could you maybe talk a little bit about, in the pre-MX era, what the challenge was in trying to get these types of alerts from all the various hospitals that your providers would have patients being seen at, right? And who they would need to follow up with for discharge, and how things changed, how life changed once MX was able to provide you with the notified service.
Yeah, previous before MX, it was a lot of, manual processes, a lot of legwork behind. I mean, monitoring a fax server, hoping that the fax comes in, trying to match the fax up with the right patient, things of that nature. And then also trying to get direct access to the hospital systems. Sometimes they did have their own portals and they'd allow us to, but then of course that opens up their own security rules that you have to match up against, things of that nature. And so in those days past, we would, of course, would use those faxes, things of that nature. But ultimately, once we moved over to really using MX and be able to actually go out and grab the discharge summary ourselves or look at the lab reports ourselves, and then go to the next level of actually pushing that in real time to our case management team, it definitely not only reduced costs because of the labor involved, but also it just speeded up the process of being able to help the member. Our group personally, we have a requirement that whenever a member discharges from the hospital, we have to have a nurse do a follow-up within like 72 hours, right? And so a lot of times what would happen is just trying to wait to get the discharge summary from the facility, you'd already be, a day, two behind in that process. So now being able to get it in real time, at least know that they are discharging and see the orders and the meds that are already available to them, it's really helped us out. I'd say one other added benefit is the medication list. So obviously the providers, the PCPs have the meds they've prescribed, right, in their EHR. But then you always are curious, well, what happened at the hospital? What were meds prescribed? And does that align to the med adherence that they really should have? So using MX, we actually have our case management on discharge. They'll review the med list that comes from the facility and make sure that that aligns with what the PCPs know, or even the specialists we have on our platform as well, to make sure that those are coherent with each other.
Wonderful. I think what you're describing is just, the ideal, what we really aspire for, right, in terms of the capabilities and the support that we aim to provide for groups like yours to really get the most out of not just the tools of MX, but the data that's delivered, through the platform. Obviously, technology is only one part of it. There's also the soft touch of actually making providers and care teams especially comfortable and familiar with the platform. Making it kind of like trying to mitigate the scare factor of encountering a new type of technology, and
Yes.
really showing them how it actually makes life easier, and helps them, manage better care both on an individual patient as well as a panel-wide basis. Uh, could you maybe speak to how MX and Choice have been able to work together to get not just training out to your providers, but also engagement and feedback so that we can always iterate and improve how we provide that service?
Yeah, definitely. So we've actually partnered with MX. You guys have been willing to actually do presentations at our provider PCP meetings and specialist meetings. We also have a direct account manager who's great. She's helped us out numerous times. If there's been a provider that has questions, we'll join together and do a Zoom session in real time where we can share the screen. We can actually walk through the Access platform so the providers are real comfortable with it. Also, what we've actually tried to push in our company or our group is having some access champions, right? So staff that is dedicated, that knows the module well, and that the providers can call in and get assistance when needed. And really, once they get on the platform, we try to do a one-on-one training with each provider office. And then within the office, we try to have a champion for the office, a go-to person that can correspond directly with our team or directly with the MX support team.